there, welcome back to our channel. Today, we're diving deep into a crucial topic, HIV. It's a virus that affects millions worldwide, yet many aren't aware of the early warning signs or how it impacts life expectancy. Stick around as we uncover the 10 early signs of HIV that might just shock you. Plus, we'll explore how understanding these signs can play a vital role in managing the condition and extending life expectancy. Let's get started. But before we jump in, don't forget to hit that subscribe button and ring the bell to stay updated on our latest videos. Now, let's delve into the world of HIV and its early warning signs. Number 1. Unexplained fatigue. Unexplained fatigue can be a symptom of HIV, the human immunodeficiency virus. HIV attacks the immune system, specifically CD4 cells, which are crucial for fighting off infections. As the virus progresses, it can weaken the immune system, making the body more susceptible to various infections and illnesses. This constant battle can lead to persistent fatigue, even with adequate rest. Additionally, HIV can cause inflammation throughout the body, which can further contribute to feelings of exhaustion. Other factors such as opportunistic infections, medication side effects, and psychological stress commonly associated with living with HIV can also contribute to fatigue. It's essential for anyone experiencing unexplained fatigue, especially when coupled with other potential symptoms such as fever, sore throat, swollen lymph nodes, and unintentional weight loss, to seek medical attention for testing and diagnosis. Number 2. Persistent fever. Persistent fever can indeed be a symptom of HIV, particularly during the early stages of infection. When the body first encounters HIV, it initiates an immune response, which can manifest as flu-like symptoms, including fever. This initial acute HIV infection phase, often called seroconfusion, typically occurs within the first few weeks after exposure to the virus. During this phase, the body is actively fighting the virus, leading to symptoms such as fever, sore throat, swollen lymph nodes, headache, muscle aches, and rash. However, it's important to note that not everyone with HIV will experience these symptoms, and they can easily be mistaken for other viral infections. After the initial acute infection phase, some individuals may not experience any symptoms for years while the virus slowly damages the immune system. However, as HIV progresses and the immune system becomes further compromised, recurrent or persistent fever can occur as a result of opportunistic infections or other HIV-related complications. Persistent fever, especially when accompanied by other symptoms such as fatigue, unexplained weight loss, night sweats, and swollen lymph nodes, should prompt medical evaluation for HIV testing. Number 3. Sudden weight loss. Sudden weight loss can indeed be a sign of HIV, particularly as the virus progresses. HIV attacks the immune system, specifically CD4 cells, which are crucial for fighting off infections. As the virus replicates and damages the immune system, the body becomes less effective at defending itself against infections and other diseases. This can lead to a variety of symptoms, including weight loss. When someone has HIV, they might not feel as hungry as before. This happens because HIV can make it hard for the body to take in nutrients from food, so even if they eat, their body might not get all the good stuff it needs, which can make them lose weight. HIV can also make the stomach and intestines inflamed and damaged, which can stop the body from absorbing nutrients properly. Because it weakens the immune system, it makes it easier to get other infections. These infections can affect how the body absorbs nutrients too, leading to more weight loss. Also, HIV can change how the body uses energy and stores fat, which can also cause weight loss. Number 4. Swollen lymph nodes. Swollen lymph nodes, also known as lymphadenopathy, can indeed be a sign of HIV infection. Lymph nodes are part of the body's immune system and play a crucial role in filtering out harmful substances such as bacteria, viruses, and abnormal cells. During the early stages of HIV infection, particularly during the acute phase, the virus rapidly replicates and spreads throughout the body. This can trigger an immune response, leading to inflammation of the lymph nodes, resulting in swelling. Swollen lymph nodes in HIV infection are commonly found in areas such as the neck, armpits, and groin. However, it's important to note that swollen lymph nodes can also be caused by other conditions such as other infections, bacterial, viral, or fungal, autoimmune diseases, and even certain types of cancer. Number 5. Recurring infections. Recurring or frequent infections can indeed be a sign of HIV, particularly as the virus weakens the immune system over time. HIV attacks and destroys CD4 cells, which are crucial for the body's immune response against infections and diseases. As the number of CD4 cells declines, the immune system becomes less effective at fighting off infections, leading to an increased susceptibility to various illnesses. Common infections associated with HIV are opportunistic infections, bacterial infections, viral infections, and fungal infections. Number 6. Skin rashes. These rashes are often part of the acute retroviral syndrome, which occurs within the first few weeks to months after initial exposure to HIV. The rash typically presents as a maculopapular rash, which means it appears as flat, red areas, macules, and raised bumps, papules, on the skin. The rash typically manifests as a red or reddish-brown discoloration, sometimes slightly raised, and may occur on different areas of the body, with a preference for the trunk and limbs. Itching may or may not accompany the rash. Typically, the rash appears symmetrically on both sides of the body and follows similar patterns. While it usually resolves spontaneously within a few weeks, the duration can vary from person to person. Number 7. Thrush. Thrush, also known as oral candidiasis or oropharyngeal candidiasis, is a fungal infection caused by Candida species, commonly Candida albicans. While thrush can occur in people with healthy immune systems, it is more common and often more severe in individuals with weakened immune systems, such as those living with HIV. Thrush presents as white, creamy patches on the tongue, inner cheeks, roof of the mouth, gums, or throat. These patches can sometimes resemble cottage cheese in appearance and may be accompanied by redness, soreness, or difficulty swallowing. Number 8. Night sweats. Night sweats can indeed be a sign of HIV, particularly during the later stages of infection. Night sweats associated with HIV are often severe and drenching, causing a person to wake up with their clothes and bedding soaked. Night sweats in individuals with HIV can stem from various factors. Opportunistic infections, a common consequence of HIV-induced immune system weakening, pose a significant risk. Conditions like tuberculosis, prevalent among HIV patients, frequently coincide with night sweats. Furthermore, hormonal imbalances resultant from HIV infection can contribute to this symptom, exacerbated by certain antiretroviral medications. Additionally, the heightened risk of lymphoma in HIV patients, particularly lymphomas affecting chest or abdominal lymph nodes, underscores night sweats as a potential symptom of this cancer. Number 9. Joint pain. Joint pain, headaches, and migraines can all be associated with HIV, although they are generally less common as initial symptoms compared to other signs like fever, fatigue, swollen lymph nodes, and rash. However, as HIV progresses, it can lead to various symptoms affecting different parts of the body, including the joints and head. Number 10. Headaches and migraines. Headaches and migraines can sometimes serve as indicators of HIV infection. While headaches are a common ailment with various causes, individuals with HIV may experience them as a symptom of the virus. HIV-associated headaches can range from mild to severe and may persist over time. Migraines, characterized by intense throbbing pain, often accompanied by other symptoms such as nausea, sensitivity to light and sound, can also occur in those with HIV. These headaches and migraines may result from the virus itself, opportunistic infections, or side effects of medications used to manage HIV. Therefore, if someone experiences persistent or severe headaches along with other HIV-related symptoms or risk factors, it's advisable to seek medical evaluation and testing for HIV. That's all for today. If you found this video helpful, give it a thumbs up and share it with your friends. And don't forget to leave a comment below sharing your thoughts or any questions you might have. Until next time, stay informed, stay empowered, and take care of yourselves.